The way I put it is every community has a river of healthcare money flowing through it. And the source of that river of healthcare money is all of our pockets. And it should work like a water cycle and recycle and replenish and restore health in our community. But instead, there's these giant corporate pipelines extracting it to Wall Street and their water carriers and leaving us all in drought. And that's, again, that's an option that we're de facto accepting until we don't. And that's the game change is this reclaiming sovereignty, reclaiming that community connection, and everything changes after that.
Yeah. We just spoke to a school district earlier today, and, they almost have $1,000 single premiums, almost $3,000 family premiums, and the cost is going up, 8 or 9%. And so we asked, well, how's your plan performing? And, really couldn't give us any sort of insight into, of that premium that he's paying, what did they pay out in claims? And so I'm also feeling like we're seeing a shift in people asking for that data because he now put that on his to-do list. And in a world that we live in today, data is everything. And I think employers have traditionally just, wrote the check and then just said that, oh, well, this carrier is going to work on my behalf in a trustworthy manner. But now we're starting to find out, that that's not actually happening. And, the lawsuits are popping up, right and left. And so, I mean, data is everything. And, if a business owner sees any other line item increase by 10 or 20%, they're probably going to ask why or, move to a different vendor or figure something out. But we're just continuing to see, some employers just kind of accept defeat in health insurance and just continuing to sign on those, the dotted line. And maybe they're being told by their broker it is what it is. And, of course, we're trying to reach, the employers that are ready to say enough is enough. But yeah, just some comments based off what you were saying.
Yeah, I'm glad you brought up the river analogy. And I was talking to a city manager today, and I did more of a meatball calculation. I said, you realize you have about 120 million. This is a community of 11,000. Said, yeah, rough estimate, you've got $120 million that's being evacuated out of your city every year. That's going to shiny buildings and faraway places. And, we're raising our kids. I live in a small town and we raise them and then they're sent off to college, never to return. And, we've seen what's happened, the blight of manufacturing and it goes on and on. But that was, perfect timing on that. And I think it's also important that, that we're definitely talking big world ideas, but the way Health Rosetta was built and the way the community connected health was built is we've scaled these big ideas like the Tom Emmerich from Walmart and Caterpillar, who, obviously was an influence on both of our careers, Dave, but we've been able to scale these programs now to much smaller employers. I mean, we're writing these options down for employers even under 50 employees. Because that's the other thing, we get that pushback. It's like, oh, well, they immediately get nervous that we're going to take their doctor away from. Like, no, that's not going to happen. We're going to give you some options because everybody remembers zero, and that's kind of where we're going to lead things here. That's where you're going to win. That's the promised land. But I want to make sure I emphasize that as we're discussing, people are tuning in on this podcast, CFO, CEOs, HR specialists, that we've scaled this down. And it's by virtue of the work that Health Rosetta has done.